All right, so tonight's presentation is taking down tobacco. First things first, everyone will be muted to minimize background noise. Have a question, drop it in the chat box below. This session is being recorded, only the slides, not you. A little about me, I received a master's in science and public health and have experience in public health and in the for-profit sector. I serve as the health policy coordinator at Mecklenburg County Public Health in the Office of Policy and Prevention with a focus on tobacco control and priority populations. In addition, I serve organizations, partners, and individuals in policy systems and environmental changes. What you will learn today is health impacts of tobacco use, types of tobacco, policy, the cost of tobacco use, quit resources, and medications. Answer these two questions. Type your response in the chat box below. What brought you to the training today? What do you hope to accomplish today? So let's take about 30 seconds to review your chat. So it looks like we do have some responses. Deeper knowledge, church ministry, latest info on e-cigs. Candace says, Zandria invited me. I'd like to learn about quit resources. My church family. I brought an open mind to learn more. So good, good. So it looks like we got Zandria, Tanya, Candace, Gwen, and Dr. Mead. And my mother. That's a good reason to be on. I like that response. Great. So it looks like my slide is a little frozen at this time, so it will advance. All right, so tobacco use impacts everyone. So a few people mentioned, I want a deeper knowledge for my mother. So all of those are great responses. So as you know, tobacco use impacts everyone. Smoking is the number one preventable cause of death and disease. 1 in 5 deaths and 1 in 3 cancer deaths is tobacco related. For every 1 death, about 30 people are sick or disabled. And 38,000 deaths each year are from secondhand smoke exposure. So that's why we like to share with everybody that tobacco use impacts everyone. It impacts the actual user, and it impacts the family and others around you, and including in the work site. Smoking damages nearly every part of the body. So in this picture, you see that there's some areas of the body that are highlighted in red and others are also highlighted in black print. The areas highlighted in red are areas of the body that in the last 10 years we have discovered that tobacco use impacts those organs or damages that part of the body. One of the areas you'll see is highlighted is diabetes. The reason we like to talk about that is because if you think about it, if you are diabetic and you do use tobacco, it's going to make those diabetes medications work a little bit harder. So imagine if we were on that journey to quit and stay quit, you can reduce the amount of medication that you're potentially on for diabetes. It also causes other organs to work a little bit harder and also could fail. In a nutshell, this is a number that we typically use a lot in our area of study. 480,000 deaths are attributed to tobacco use every year, and particularly to cigarette use. So there could be some increases if you add in other types of tobacco. So when you combine some other areas such as cancer, stroke, COPD, heart disease, and lung cancer, if we add all of those up, this still doesn't add up to the number of 480,000 deaths each year from cigarette smoke. So a little bit about secondhand smoke. Most of you have heard about secondhand smoke, and you understand that it impacts every single one of us. However, in this depiction, you see that how it impacts those areas of the body. For example, the little baby, it could cause sudden infant death syndrome, also known as SIDS. In small children, in babies, you can see that it can impair your ears and also your lung function, also cause some respiratory symptoms. We're going to talk a little bit more about respiratory system symptoms later on in the presentation. Also can cause some lower respiratory illnesses. So what that means is if you have a cold or perhaps some sinus issues and they can go away on their own after a few days, if you're a tobacco user, those issues can happen for a much longer time. And it also impacts the pregnant mom as well. It could also cause low birth weight. And then in other adults, it can cause nasal irritation, heart disease, lung cancer, and including stroke. You'll also hear us say there's no safe level of tobacco. There's 7,000 chemicals in cigarette smoke. And we also know that 69 of those chemicals are cancer causing. So just about 5 minutes of secondhand smoke can hurt you. That increases your risk for asthma or heart attacks. Third-hand smoke. How many have heard of third-hand smoke? If you've seen or heard of my presentation, yeah, you probably have heard this before. Third-hand smoke remains in the environment for a long time after smoking has stopped. It also remits into the gas phases as well. Reacts with oxidants to yield secondary pollutants. So think about an image of an elevator or a home or a hotel room that you've entered into and you smell cigarette smoke and you're thinking to yourself, nobody was just here, but I smell it. That is that's an example of third-hand smoke. Those are the residual nicotine and other chemicals that are left by tobacco smoke. They fall to the surfaces such as the carpet, the walls, the blinds, and also furniture. So they really like to hug into those soft surfaces. 90% of tobacco users start before the age of 18. So be thinking about that as we move forward in the presentation. Also think about some of those family members that we talked about in other conversations, how difficult it is for them to start. This number really tells it all. 90% start before the age of 18. So many of these folks have been using tobacco for many, many years. We're going to jump right into the different types of tobacco. Here's a written version of tobacco products. So they range from cigarettes all the way to vape pens. So I really wanted to make sure that you read the names, you also get a few visuals. So cigarettes, cigars, cigarillos, which are also known as little cigars, dip, there's e-cigs, there's e-juice, Juul is the name of a brand. Heated tobacco, such as IQOS. IQOS is I Quit Ordinary Smoking. Hookah, pipes, smokeless, snus, vapes, and vape pens. Here's an example of some of those items that we talked about. On the top left of the picture, you see your electronic devices. Some of these images are familiar to you, such as traditional cigarettes, little cigars, maybe even snus. Some of these e-devices may be a little bit harder to understand what they are. They mimic other pieces that we have in our home, such as zip drives or flash drives. On the bottom right is a new product called IQOS. That will be coming to the Charlotte market in April of this year. Of course, due to the current situation of COVID-19, there is a delay in that shop being open. So you just saw some images of those tobacco products. So how did we get here? Well, the tobacco industry spends $1 million an hour just marketing their tobacco products. Again, that's just the marketing pieces of it. So $1 million an hour, could you imagine what you could do with $1 million an hour? Some traditional types of smokeless, some traditional types of tobacco would be smokeless tobacco. Here are a few images. This one's called snus. Snus looks like a little tea bag, and you would insert it into your mouth. And this is a product that, unlike snuff, you do not have to spit out. You would just keep the product in your mouth and swallow it. It does come in many different flavors and sizes. Most of them come in tin cans, such as the ones in the picture. Smokeless also does not mean harmless. So using snuff or chewing tobacco 10 times a day is equivalent to the nicotine level of 40 cigarettes or 2 packs a day. So again, we didn't show you any images of traditional cigarettes on this particular slide, but keep in mind that smokeless is not harmless. Electronic nicotine delivery system, that is the professional name, also called ENDS. Other terms you may hear would be electronic cigarette, e-cigs, vaping, also juuling. Those are the common terms that we typically hear when we talk about e-cigarettes. On the bottom left, we go from the first generation to the third generation. There are other products that mimic that platform. Some of our cellular devices, sometimes our laptops, we speak of our devices in terms of generations. So as we move from left to right, those generations get a little bit sleeker. They also get a little bit smaller. And also their price increases too, because they're typically the newer product. Here's an example of some of those products that go from the first generation to the third generation. We go from the Juul marketing here. We also see the My Blue marketing. My Blue is a product that their headquarters is here in Charlotte, North Carolina. Juul is on the West Coast in California. But these are two popular devices that many people enjoy to use. The purpose of the slide is just to get you to show the sizes of the devices, the colors, the different flavors, and also how they could be mistaken for other devices in the home or at the work site. Marketing, we talked a little bit about marketing and how we spend about $1 million a year on tobacco marketing. These are some examples of electronic cigarette marketing that have landed in some of our newspapers in our local markets. They all have different people on there. They're very diverse. They also have different genders on there. The purpose is to be able to speak to a wide range of audiences. So these are little cigars, and these are also called flavored products. You may hear some chatter in the media about flavored products such as menthol and fruit flavors. On this slide, we really wanted to highlight the different fruit flavors. And they also are sold in small packs, and they're cheaper than cigarettes. So there's a different demographic that really enjoys these products. One, because they're smaller. Two, they're cheaper. You can see here in the picture, you can get 2 little cigars for 99 cents, or you could purchase one for 69 cents. Menthols are easier to start smoking and harder to quit. Most of you have heard of that word menthol. So I really want us to really think about that in terms of a flavor, and also think about some of our family, our friends, colleagues who may use menthols. They're really easy to start because there's a cooling sensation that goes into the mouth, and also is cool on the throat. So that means it's less harsh. And it's minty tasting and has less of that chemical feel, which is why it is difficult to stop quitting. We always want to include all other forms of tobacco. Hookah is definitely one of those products that is on the rise. In 1 hour session, a user can inhale smoke equivalent to 50 or more cigarettes. So why is this important? This is an example of a hookah, and I also have it labeled so you can see from the top to the bottom. There's the bowl all the way down to the base. Most of us have seen the bases and think that there's water inside of the base and that we're only inhaling water. Keep in mind that hookah has the same health outcomes as cigarette smoking. It can cause cancer, heart disease, and lung disease. So although there is some water in the base, at the very top of that, you have your bowl, your grommet, and your ashtray. That is the area where you would put your shisha, which is your liquid, excuse me, not your liquid, but your, it's the tobacco or herbal tobacco that goes up there and you inhale it. So that's important to really understand that this session is not very innocent and that it's a session that can also lead to other poor health outcomes. Here's an example of a hookah use in a social environment. That typically we have seen this in social areas and it's practiced and also in other cultures. Excess smoke inhalation in long hookah sessions. People tend to share the same pipe around, but you do get a different mouthpiece. So there is a possibility that sharing the same pipe can spread disease. And there's also harmful chemicals that we talked about. E-cigarettes and marijuana. So I know that's the question that people tend to ask. What's the difference between marijuana and e-cigs, or people using them together? The answer is there are some that are using them together. E-cigarette products can be used as a delivery system for cannabinoids and potentially for other illicit drugs. So on the left here, there's an image of a liquid THC, and on the right, I have an image of a bottle of CBD oil. Both bottles look very similar. However, they're labeled one that says THC and one for CBD. Here in North Carolina, CBD is a legal substance to use in many different ways. THC is not a legal substance in North Carolina at this time. So THC and CBD are the two best known cannabinoids that recently received a lot of attention. And it's estimated that more than 80 cannabinoids are present in hemp and marijuana plants. So hemp versus marijuana. So that basically would be CBD versus marijuana or THC. Lots of interchangeable words today. So they're both cannabis. They come from the same plant. Some people like to call them cousins. Only the difference is hemp has 0.3% THC or less than and is high in CBD. Causes issues for law enforcement and DAs. So the reason we say it causes issue is because at first sight to a law enforcement, particularly in North Carolina, it may be hard to visually determine if this is CBD or THC, especially when THC is not legal here. It still can cause issues for law enforcement in areas where it is legalized as well. THC is the psychoactive cannabinoid found in cannabis and is illegal. So again, illegal in North Carolina. However, CBD is legal across America. We do know that hemp farms are increasing across the state. The state ban on hemp flower proposed, and that continues to be delayed. And just like most policies right now, some policies are getting hung up right now due to the COVID-19 crisis. The purpose here is just to understand that there's a few documents out there where you can read about e-cigs and marijuana. For purpose of time, I just wanted to include them here. So e-cigarette use among youth and young adults is a document that came as a report from the Surgeon General out of the CDC. And on the right, the health effects of cannabis and cannabinoids. And so the outcomes from both of those documents are similar. We hear poor performance in cognitive domains of learning, memory, and attention. That's in the conclusion on the right. On the left, we talk a little bit about cannabinoids and potentially for other illicit drugs. So that means a gateway leads to other issues, where on the right, we talk a little bit about cognitive domain, poor performance. So we want to make sure that when we're speaking to youth and young adults that we really let them let them know that there could be some memory delays and attention delays. Here's just some examples of devices and pods. The one on the left, you're going to see your pod, or your those are little small cartridges that would go inside of an e-cig. And that e-cig would then be utilized to use your marijuana or THC. The devices on the right are some that you can purchase in some stores. So you can see that it says Runts and Sour Patch Kids. So they really are drawing in different audiences with those flavors. Here's just another example of some of the devices, the packaging, the marketing, also the flavor. So again, just think about all these flavors such as banana, lemon. These are all flavors that we're familiar with. We have those in our home in terms of to be able to eat and digest. However, these are flavors that are not meant to be heated and aerosolized and inhaled into the lungs. So who's impacted the most? Youth. Youth are impacted because they like those flavors. Flavors target kids. Kids turn into young adults. Flavors have overwhelmingly been used to attract those who have not previously used nicotine or tobacco products. So that's where we talk about flavors hook kids. If you put something on a label and it says bubblegum flavor and it's a tobacco product, that young person will try the bubblegum. If it says creme brulee, they're more likely to try that product because it says creme brulee. It's a sweet flavor, or even cinnamon. It's a flavor that they are comfortable with. Here's a little bit of data on our youth uses. So this is from the National Youth Tobacco Survey from 2019. The purpose of this slide, I really want you to see about 31% of youth have used any tobacco product, and these are youth from high school. The number one product, as you can see, is an e-cig followed by a cigar. So those were those little cigars that we talked about earlier, the 2 for 99 cents, the 69-cent ones, the ones with the funny flavors and then the funny packaging. They're attracted to that. Youth are not so much attracted to the hookah and also the smokeless tobacco that we talk about. However, as we know with our adult audiences, they're more likely to use some of those tobacco products. So this is a slide that also depicts flavors that are popular among high school users of e-cigs. So just extracting just a small population here. In 2019, we see that 65% of youth enjoy fruit flavor, followed by menthol or mint. So why are we concerned? As we mentioned before, fruit flavors hook kids. We talked about menthol or mint being a flavor. Those are flavors that young people are attracted to. And this is just from a high school audience here. A new product that's on the market that young people are really interested in are puff bars. These are disposable products. They're fairly new to the market and came on in December 2019. This is a product that you use it a couple times and then you throw it away. These flavors are called OMG, such as orange, mango, guava. And again, target audience is youth, and it looks very similar to some of the other products we've seen before. Health concerns around vaping. Again, just as we didn't talk about addiction earlier, but all these things lead to addiction. Poor respiratory health, inflammation, dual use, unknown heart health, and also unknown long-term health effects. This slide's a little wordy, but I want you to see that on the far left, in terms of nicotine addiction, on a dependency scale of 1 to 6, it is the highest addictive substance on the market, on the legal market, and you can be really dependent on it. So no matter how you package it, remember we said this earlier, there's no safe tobacco product. So I know many of you really want me to dive into some quit supports, and we are getting ready to do that at this time. So coronavirus in 2019 and tobacco use. So does coronavirus and our lungs mix? This is the best time to begin your quit journey if you're a tobacco user. Tobacco users that are impacted by COVID-19 get sick quicker and they stay sick longer. I really wanted to highlight a neat toolkit that just came out a few days ago from our agency, Mecklenburg County Public Health. It is, if you just go to mecnc.gov, look for public health, there's an outreach toolkit for targeted populations. There are a number of resources at the bottom of that webpage. I would highly recommend you all to review it. This is all related to COVID-19. I snipped out one slide that really impacts what we're talking about tonight. So why are African Americans being hospitalized and dying due to COVID-19? So just that first sentence that we really want to think about is most African Americans have conditions like hypertension, heart disease, diabetes, and obesity, and that makes COVID-19 more severe and deadly. So these are graphics that you all can use with your health and human ministry. You can also use it with your family. I know someone mentioned their mom. So when we talk about tobacco use, we really want to think outside of our box and think about other issues that can impact our bodies. And COVID-19 can impact a healthy body. So it certainly will impact someone that has compromised lungs. So not today, COVID-19. So we're not going to be using tobacco. So this is going to be our start for a quit journey here. And just wanted to highlight a few things. The Surgeon General just came out with a smoking cessation report earlier this year. And we'll focus on that first one. So smoking cessation is beneficial at any age. We talked a little bit about the data and the numbers, but it also places a burden on the family and the society. So Quitline NC, so again, that is www.quitlinenc, has a number of programs that are available for anyone that is interested in quitting and staying quit. I love this program that they have, and they continue to update it. And North Carolina has set aside a good pot of dollars to fund this program. We'll start with the first one, the behavioral health program. So anyone that presents with any behavioral health diagnosis, would qualify for the program. They would get 7 calls and 12 weeks of patches and gum and lozenges. So that behavioral health program, they just say yes or no if they have anxiety or depression or any other number of illnesses, and they qualify for the program. You do not have to present any insurance cards or anything. If you're uninsured, you still qualify for a number of resources. If you have Medicaid, you qualify. And even if you have other types of insurance, you do qualify for a number of programs. But this is a way to get assigned a quit coach that will help you get through the quit attempts and also mail you patches and gum. So there are 7 FDA approved medications. I do realize that not everyone that's joining us this evening uses tobacco. So I want to highlight that there are 7 FDA approved medications. So that's the nicotine gum, the patch, the lozenge, the nasal spray, inhaler, Wellbutrin, and Chantix. So yes, there is a nasal spray and also an inhaler. Those are 2 that are least likely to be purchased. You're more familiar with the gum, the patch, and the lozenge. We also have heard of Wellbutrin, which is used for other areas of the body. It's also used for depression as well. And Chantix is also available. NRT is also in nicotine replacement therapy. You'll hear me say NRT for short. And the reason I want to dig into NRT a little bit is so that you are going to be your resources at your church, and you'll be able to speak to patch or gum and lozenge. Sometimes people will listen to you when they really are trying to quit. So now you can say to them that the patch is over the counter, and the gum is also over the counter, and the lozenge is also over the counter. What is required by a prescription from your doctor would be the inhaler and a nasal spray, and also Chantix and Wellbutrin that we talked about as well. But there are some that are over the counter. Many of our drugstores and big box retailers sell these products over the counter in our area. Did you know that 63% of smokers want to quit? So those family members, the church members, your friends who've really been trying, they really want to quit. And if you combine their willingness to quit and counseling, whether it's over the phone or group session plus medication, that's a successful quit attempt. That's a successful journey. One policy I really wanted to highlight, and there's several, I wanted you all to know that the FDA did raise the tobacco purchase to 21. That happened in December 2019. In North Carolina, prior to December, it was age 18. We are now age 21 in North Carolina, as well as the entire United States. So that is a great move because that protects our youth and young adults for a few more years. One thing I wanted to talk about in terms of some programs that are evidence-based, there's some tobacco industry sponsored youth prevention programs in schools, and we don't want tobacco industry sponsored youth programs in any schools. So we recommend, if you are looking for some evidence-based programming in schools and also for young adults and adults, please review the CDC's website or come to us for some additional resources. One of those programs that we are aware of is Project Connect, and that is sponsored by one of the tobacco someone from the tobacco industry. So that is not a program we recommend. My slides. So here is a slide from the Truth Initiative, because we talked a little bit about Quitline NC. This one's from the Truth Initiative that talks about Ditch Juul. Ditch Juul has their own unique way to help with quitting, and it's through cell phones. You just text Ditch Juul to 88709. The really unique thing about this program, it is designed for those who are youth and young adults who may not be ready to enter into that Quitline NC. Also, it would be for youth who are not age 18 or 21, where they cannot access some of the medications and maybe are trying to quit through some motivational interviewing. And these are positive messages that they'll receive from Truth Initiative to help them with their quit. So we talked a little bit about the Surgeon General report, and that last one is smoking places a substantial financial burden on smokers. So the cost of smoking related illnesses in the United States. So again, this is the US. We can break it down to North Carolina and also to Charlotte, but overall it costs $326 billion a year for smoking related illnesses in the United States. So we often hear that in terms of lost productivity, $156 billion, and also direct medical care to adults, that's $170 billion. Cigarette prices and consumption. So as the cost of cigarette prices increase, consumption goes down. So we often hear that in terms of pricing and taxes. Each state in the United States has different prices and also different tax on cigarette sales. So we like to throw this chart around, and we'll just focus on day one. So day one, if you wanted to understand the cost of smoking in dollars, and if you were half a pack a day, you would save $2.50. If you're a pack a day, you would save about $5. that money definitely increases over time. This is a cost indicator we like to share with people who are currently on their quit attempt because they like to see that they're saving money. What happens when you quit smoking? Did you know that in 20 minutes, your heart rate and blood pressure returns to normal? Over time, breathing improves. Over time, coughing improves. And even longer than that, your risk of heart disease also improves. So everything that we talked about are winning strategies, but here in a nutshell, if you integrate tobacco treatment into, integrate tobacco treatment simpler into other treatment programs. So you want to make it simple. And combination of NRT and counseling, tobacco-free indoor air policies and workplace tobacco policies, and I should include tobacco-free church policies as well. Those are all combined winning strategies. Think about earlier in the presentation when we talked about secondhand, thirdhand smoke. With your campuses and your churches being tobacco-free, it really helps that others are protected from the secondhand and thirdhand smoke exposure. So if there is a vaccine, this is what it would look like. It would include smoke-free policies, hard-hitting media campaigns, cessation access, tobacco price increases. So cessation is that word that we talked about in terms of medication and NRT, the quit process, whether it's in-person, group. You could do your quit attempts online as well. You can also do your quit attempts through virtual trainings like we're doing today. But if there was a vaccine, this is what it would look like. And we know that it works. So some of the things that you all can do, No Menthol Sunday is coming up, and I dropped that tool into your chat box earlier today. And so on May 17th, you can join the faith community and the rest of the United States and declare that day No Menthol Sunday. There's a great toolkit. You can be creative. We know that we'll most likely be virtual on May 17th, and there's some examples in there on how to execute that. There will be some more trainings that I'll be hosting in May 2020. So I welcome you guys to join me in May. We have about 3 more sessions. So stay tuned to Village Heartbeat's website, and here's the link here. I also want to thank Kim Bea, who's with the Office of Policy and Prevention, for the platform. Gwen Devins, who's our co-host for the evening. She's with the Office of Community Engagement. And then thank you all from Antioch Missionary Baptist Church, for you all with the Health and Human Ministry. Thank you for being the leaders and taking part of this presentation. And all my other colleagues, and Salita for joining as well. Here's my contact information. And you can certainly reach me by email, or you can call me or text me. I'm certainly available. And then we will end that here and open it up for questions.
And so there's something you said, the
IQOS.
Thank you. It's coming. It was supposed to be coming here now?
Yes, it was supposed to be here in April of this year.
So in March, things start time.
In April of 2020. It's delayed because of COVID-19. We do not know where IQOS will be. We have seen pictures of it in the Atlanta market. There is a store that says IQOS, and it looks like a small iPhone store.
Okay.